Hi, my name is Francisco Chavez, and today I'm going to talk about genetic drivers of kidney defects in the DiGeorge syndrome. Introduction. The DiGeorge syndrome is a debilitating multisystemic condition that features with variable expressivity cardiac malformations, velopharyngeal insufficiency, hypoparathyroidism with hypocalcemia, and thymic aplasia with immune deficiency. It is caused by deletions on chromosome 22q11.2. The genetic driver of the kidney defects is unknown.
The name DiGeorge syndrome isn't the most descriptive name, which is why it's also often referred to as 22q11.2 deletion syndrome, which is actually pretty descriptive and describes a condition in which a small portion of chromosome 22 is deleted, which causes a bunch of developmental abnormalities and complications. All right, so our chromosomes are composed of genes, right? Which are essentially instructions for everything from development to day-to-day survival. And these genes are spread out across 23 pairs of chromosomes. 22q11.2 is like an address. So 22 stands for chromosome 22, with Q designating the long arm of the chromosome. Then it's on region 1, band 1, and subband 2.
Sign up for a free trial today and watch the full video on osmosis.org.
Applications in medicine. In a genome-wide search for rare copy number variations in a discovery cohort of 1752 patients with congenital kidney and urinary tract anomalies, we identified deletions at the chromosome 22q11.2 locus in 11 patients. An analysis of breakpoints indicated that all deletions in the 11 patients overlapped with the common deletion between LCR22A and D. 2 patients had the classic deletion of DNA between A and D. 1 patient had a smaller deletion bounded by B and D, and 8 patients had the smallest deletion between C and D. Pros and cons. Pros. The therapy for DiGeorge syndrome is focused on correcting defects in the organs and tissues that are affected. Therefore, therapy depends on the nature of the defect and its severity. Cons. A small percentage of affected children with great immunological or cardiac deficiencies don't survive to the first years of life, but the majority exceed this age and will reach adulthood. Diagnosis: an analytical and immunological study, abdominal ultrasound to rule out kidney abnormalities, echocardiography and fluorescent in situ hybridization or FISH studies designed to detect small clusters of deleted genes in the 22q11 region.
Twenty-two q deletion syndrome is a chromosomal condition. It's the most common autosomal deletion syndrome. What is that? Autosomes are the non-sex chromosomes. We have 46 chromosomes, 23 pairs. One pair of the sex chromosomes, and the other 22 are numbered chromosomes. 22 is one of them. And there's a small missing piece on chromosome 22 that causes all of the problems associated with it. There are many issues that can be seen with 22q deletion syndrome. The most common areas are the palate, the heart, immune system, calcium, learning problems, growth, and sometimes psychiatric problems. There are certain specific chromosome tests that we do to diagnose this. One of them is called a FISH test, which stands for fluorescent in situ hybridization. We take a probe that attaches itself to the area of the chromosome 22 that's missing, and it's a fluorescent probe, so it will light up if it's there, and it won't light up if it doesn't. We can also do a special molecular cytogenetic test called an array, where it will show many areas within all the chromosomes that are deleted, and it will pick up the 22q deletion as well. I have been seeing patients with this before we even knew about the 22q cause of the particular syndrome that they have. In the old days, they were called DiGeorge syndrome or velocardiofacial syndrome, and now we know both of those syndromes are the same thing. They're both caused by a deletion in chromosome 22q.
Issue applied in Ecuador. In humans, the chromosomal 22q11 deletion is the most frequently found interstitial deletion, of which between 5 or 10% are hereditary. The estimated incidence is greater than 1 in 4,000 births, and 22q11 interstitial microdeletion has been described in 5% of newborns with heart defects.
Kirsten was born April 7th, 2005. And I think we knew from the beginning when she came home from the hospital that something wasn't quite right. She had a very difficult time nursing. And within 2 weeks, we found out that she had a heart disease. She was always very petite. She was very small. But when she became mobile and it was time for her to start talking, she was talking, but nobody could understand her. Her sounds weren't developed. She had asthma. We were in and out of the hospital for croup, just constant infections. Around the age of 5, at her 5-year well visit, we discovered she had scoliosis. I've always said, something's not right. I feel like everything's connected. And everyone just kind of said that, no, the scoliosis really wouldn't have anything to do with her speech, or the speech really wouldn't have anything to do with her heart, and their frequent illnesses, kids just get sick. She needs to be in a place where everything's comprehensive and everyone talks to each other, because I felt like maybe that was one thing that went wrong with our story, is that the doctors were looking at her medical records, but they weren't really speaking to each other. every person at this facility that has spoken to us has wanted to know our story. They literally have taken the time to speak with us, to listen to us, and to learn as much as they can. And that's what made me want to come here. Dr. Kirshner operated on her, and now she is talking completely normal, and that was important to us because with 22q, she's always going to have hurdles, she's always going to have struggles, but this is one thing that she's not going to struggle with anymore. All of the doctors are very compassionate, they're very understanding. You see the doctors talking to each other, and that made us feel good.
Conclusion. Molecular analysis of a presumably rare developmental disorder with a strict phenotypic diagnosis led to the genotypic discovery of the most common deletion syndrome known to date, 22q11 deletion syndrome. This multisystem syndrome is characterized by remarkable variability among individuals. Management is individualized according to the underlying pathology and relying on age and phenotype. Early diagnosis is key for optimal anticipatory medical care and family planning. Thank you.